The choice of this remedy is determined by the symptoms which develop in mental and gastric sphere. As the meaning of the last word of its name implies, the Ansi patient is crude mentally and physically. Patient is a gross feeder, a glutton. He eats beyond the capacity of his digestion or without discrimination. Therefore the mental and skin symptoms are due to the disturbance. It produces lumpy effects. Stools are watery, containing lumps. Leukorrhea is watery, mixed with lumps. Lumps appear upon the skin. Nails become thick, distorted and lumpy. There is a tendency to formation of cracks in canthi, nostrils, angles of the mouth. Mentally the patient is either sentimental ESP. In moonlight and twilight, during diarrhea and before menses, or cross and touchy. It produces strange absence of pain, where it could be expected, e.g. bed sores. It is suitable to infants and children, also to elderly persons and young persons who have a tendency to grow fat. When symptoms group recur, they change their locality or go from one side to the other. They recur every 5, 6 or 12 weeks. Gout recedes and stomach is affected. Nervous symptoms such as restlessness, twitches in the muscles, and disposition to start on slightest noise are also found. Ill effects of disappointed love and suppressed eruptions. Chronic complaints traceable to suppression of eruptions or ulcers. Marasmus, trouble from swimming or falling into water. Rheumatoid arthritis. He is always sleepy and weary. Fatak reverse repertory rubrics only important. Anger, vexation, irritability, fretfulness, bad temper. Bathing, aversion to or from aggravation. Busy, when, forgets, everything. Chin, eruption, granular, honey-colored. Constipation, diarrhea alternating with old people in. Convulsions, spasms, vomiting amyl with. Fear, anxiety, fright, touch off. Food and drinks, aggravation sour. Ovaries, painful, lovesick girls in. Urticaria, hives, wheals, meat aggravation. Dr. Sankaran says antimony is a metal which lies in the periodic table, between arsenic and bismuth. The remedies of the group phosphorus, arsenicum, antimonium and bismuthum shut out or exclude others and isolate themselves. Phosphorus feels that he is not getting enough attention and feels secure only when amongst a lot of friends, receiving a lot of attention and love. Arsenicum views the world as threatening and feels isolated and insecure. He feels secure in the company of only a few. Antimonium feels that he has been disappointed and needs to isolate himself. He feels secure in the company of still fewer people. Bismuth feels very alone and will be secure in the company of only one person, his mother. Antimonium Crudum is the sulfide of antimony. In it, we see the antimonium feeling of being let down and disappointed by others, and therefore the need to narrow one's circle, to isolate oneself. Also present are the sulfur symptoms of theorizing and fantasizing. These combine to make Antimonium Crudum a person who has narrowed himself down, and who starts fantasizing. The patient finds the world around him so disappointing that he simply shuts it out, and conjures up an illusionary, ideal world that he starts living in. He longs for that which he misses or has been disappointed by. He becomes nostalgic and longs for the past, for his native land, for the ideal woman, the woman of his dreams. He becomes poetic and sentimental. Poetry often expresses his inner wishes. He is lost in this idealization. It differs from cannabis indica or other drug remedies, because he does not create a fantasy, but only longs for and creates his ideal and becomes very sentimental. Whereas cannabis indica fantasizes, Antimonium Crudum idealizes. Antimonium Crudum's idea is a perfection of the real, perhaps practically impossible, but fundamentally reality-based. The fantasies of the drug group of remedies, on the other hand, are fundamentally not of this world to begin with. For example, he may be disappointed in love and then projects all his idealizations onto another woman. She becomes his dream girl. He does not want to face the reality of things because reality is so disappointing that he could become suicidal. He becomes dull, does not want to be touched or approached, does not want to be looked at or spoken to, does not like any attention. He is fond of solitude, and especially likes to be by himself in the moonlight. Download mobile app from Play Store, Homeomonk for learning from basics and becoming Clinical Classical Homeopath.